Today we are discussing hair. Hair is a topic that occupies the minds of many people. There are people that are losing their hair and want to halt or reverse that loss of hair. And today we will talk about all the ways that science has taught us we can slow or even reverse it. By age 50, approximately 50% of all men and women will have experienced significant enough hair loss that they start to notice it. And a large percentage, up to 85% of those people, will experience some sort of anxiety that leads them to go out and try and either halt or reverse that hair loss. Now, why at age 50? Well, an important point arises from that, which is that the hair loss is not occurring between the 49th and 50th birthday. Hair loss is ongoing from about age 30 to age 50. It's only by age 50, however, that about 50% of people out there start to notice that hair loss. And this is typically because they'll be in a bathroom or looking in a mirror, and the lighting will be bright enough that it permeates the sort of outer boundary of their hair, and they'll notice that their hair is thinning in a particular location. That's usually how this sort of thing happens. So again, our psychological states can impact our patterns of hair growth or loss, and of course, patterns of hair growth, but more typically hair loss and hair graying, can really impact psychological. Now let's talk about the accelerators on hair growth and the brakes on hair growth. There are many accelerators on hair growth, but the first one that I really want to underscore is blood flow itself, which equates to the delivery of nutrients and oxygen. This is very important, and it explains a lot of the treatments for halting and reversing hair loss. For instance, one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil. Minoxidil, sometimes also referred to by the brand name Rogaine, was actually a drug that was developed to treat hypertension. So this is a cardiac drug that lowers blood pressure, and it does that by causing vasodilation. It allows more blood flow, not just to the hairs on your scalp, but to hairs everywhere on your body. And indeed, most people don't realize this, but minoxidil won't just slow the loss of hair from your scalp. It is also effective at slowing the loss of hair elsewhere in your body. How does it do that? Well, you now know one of the major ways it does that. It does that by extending the anagen phase. So it basically makes that phase a bit longer. It doesn't make it much longer, which is why for most people who are losing their hair quickly or who have already lost their hair, minoxidil alone is not going to be a sufficient treatment. However, minoxidil has been shown to be effective at slowing rates of hair loss in people that are starting to experience some hair loss. I'll get into dosages and things of that sort a little bit later, but right now I just want to really focus on the logic of why people would take this drug, which is lowering hypertension at all as it relates to hair loss, right? That might seem like kind of crazy until you understand the anatomy and the growth of hairs, which you now do. So that's what minoxidil is doing. It's creating more blood flow to the hairs, which, because minoxidil does have this positive effect, at least most people would like to slow their rates of hair loss on their scalp anyway, it tells you that blood flow and delivery of oxygen and other nutrients from the blood is pretty critical, if not very critical, for the support of the hair growth cycle itself. Now, again, we haven't talked at all about the sorts of chemicals or the signals within the body, such as hormones, that actually direct the growth of hairs. Here, we're just talking about a mechanical change, allow more blood flow to the region and thereby extend the anagen phase, which is exactly what happens with minoxidil. Now, minoxidil does have other effects, and this is why dosing of minoxidil becomes a little bit complicated and can be a little bit tricky to troubleshoot. It can greatly lower blood pressure or lower blood pressure just a little bit, depending on how sensitive somebody is to that particular drug. So oftentimes physicians will start people on minoxidil dosages that are very low. Ideally, that would be the case, and then ratchet it up in order to figure out where the minimal effective dose or the kind of critical threshold is, beyond which they start experiencing some pretty uncomfortable side effects, such as swelling of the ankles or headaches or dizziness. These things can happen with the use of Rogaine, aka minoxidil. Now, minoxidil has also been associated with increases in the hormone prolactin. Prolactin is a hormone that's released from the pituitary, It is a hormone that acts also as a bit of a neurotransmitter, like many hormones, and it tends to be antagonistic or in opposite to dopamine. So dopamine is a neurochemical. It's actually a neuromodulator, meaning it modulates the activity of a bunch of neural circuits in the brain. It also controls the release of various hormones in the body. Dopamine is almost always associated with states of motivation, pursuit, and drive. It has a little bit of a kind of feel-good element to it, which is why a lot of people think dopamine is associated with reward and pleasure, but it's really about energy, motivation, and drive. Dopamine and prolactin are, as I mentioned before, antagonistic to one another. They're in sort of a push-pull. So people who take minoxidil, especially if they're very sensitive to it or they take dosages that are too high, will experience increases in prolactin that in turn can cause things like reductions in libido, reductions in overall feelings of well-being, apathy, and in some cases where the elevations in prolactin are more extreme, they can experience, for instance, increase in male breast tissue, gynecomastia, or even small bits of milk letdown, things of that sort. In women who take minoxidil, the side effects are much like the ones experienced in men. So there can be swelling, edema of the tissues, because if you get too much vasodilation and too much lowering of blood pressure, that's not good. Headaches, dizziness, and so on. So dosing of minoxidil is really important. If somebody's going to use minoxidil in order to try and slow or reverse hair loss, and again, it mainly is going to be used to slow rates of hair loss, not to actually reverse hair loss,